And these are the findings, but I'll show you. So this is the first CT scan that was done. Our images default in the bone window for unclear reasons. So this was the image, or the CT trauma patient. So this was read overnight, and the resident astutely said, there's this sort of weird finding in the retroperitoneum. It could be an artifact or it could be free air. Anyone have any thoughts about this? So I said I favored artifact because it looked a little bizarre. There was no local trauma. There was nothing else around it to explain this finding. So I recommended a follow-up CT abdomen and pelvis if patient clinically got worse or became symptomatic. So they got a follow-up CT abdomen the next day, and this is what it showed. It's gone. So this, and the patient didn't have any acute sort of abdomen. So I was sort of, so this was, I sort of chalked it up to artifact since it sort of resolved the next day or didn't. But I didn't know why. So then I called our physicist and I asked him, like, why do we see that weird artifact? Because it was trauma surgery and they didn't know if the patient should go, to the OR or what. So anyways, he said there were several problems, and I'm bringing this up because I think it's a really great learning case in terms of CT artifacts. Number one, he said the patient's arm is in the way, and that causes a streak artifact, as you can probably appreciate here. The other thing he said that this area is around the ribs, so it could be another source of streak artifact. The third thing he said was he looked at the pitch. This was done pitch of 1.3, and this causes photon starvation. And then so it was undersampling the area. And the second CT abdomen and pelvis was done with 0.2 pitch, so it was actually oversampling the area. So pitch is, it's, what did they say? It's like the table distance traveled in one rotation divided by the beam collimation. So if the pitch is 1, then the beam and that, like the speed of the table, they overlap. So the full area is covered. If the pitch is 2, then the gantry is rotating faster than the beam, and so you only cover half of the body, and so then you get only half of the photons. So you get like photon starvation. In contrast, if the pitch is 0.5, then each of the body parts is covered twice. So you get improved SNR, but you double the radiation. You double the exposure. So the first, for abdomen pelvis protocol, the pitch should be 1. So all the body parts should be covered once by the beam. So he said the first one, it was there was photon starvation, and the second one, it was oversampling. But that was, he thinks, a combination of pitch as well as the arm in the way and the rib. He said that when you have multiple issues, then that can cause odd things to appear on the images. So